Hello friends, thanks for coming to my presentation. This is about diabetes research. I learned about this in researching since 2010 when my father passed away, and finding out that the diet that my father followed had a lot to do with his demise, and he warned us 6 kids that we would die in a very similar way if we didn't figure out another scenario. So I went ahead and I followed the research that proves what I've always known, that it's really important to have an 80-20 diet when you have any kind of complications. When you have any kind of illness that's chronic, Bowenwork alone is not going to be sufficient to change out your energy resources so that you have what it takes to reverse the cause of illness in your body. With the 80-20, you do have a chance, okay? So you do have hope. There is hope for you. And I need you to understand diabetes first. So we're going to go through a few videos. We're going to go through who Frederick Banting is and all of that in this lecture, okay? So I'm going to pull my picture down here and we'll start with this Frederick Banting. And who was Frederick Banting? So I'll pull myself off here. Okay, so Frederick Banting was the co-discoverer of insulin, and he did this with his friend Charles Best, his co-worker, in November of 1921. So it's been more than 100 years that we have had insulin, and every researcher is in the contest every year to get the Banting Award and to give the Banting Lecture, which is the sum of all the knowledge that has been gathered about diabetes for that year. So let's first talk about Michael Brownlee. So he brought us the unifying theory of diabetes in 2004. Okay, so he said basically that with his greatest paper on diabetes ever written, he said excess dietary fat causes the reversal of the electron transport. This reversal causes a traffic jam in the metabolism, and this traffic jam backs up the Krebs cycle, or the energy cycle of the body. And since it rewinds itself, it backs up on itself, it causes other chemical reactions to happen that cause a cascade of metabolic consequences that we don't usually know about, not until this lecture was given, which is really exciting, actually. Okay, so the next guy I want to talk about is Roy Taylor. So Dr. Roy Taylor wrote the books Life Without Diabetes and Reversing Type 2 Diabetes. Now, he won the Banting Award in 2012, and he gave the Banting Lecture in 2012. And he specifically tailors a smoothie mix and a hypocaloric diet to bring enough weight loss into people's lives to reverse their diabetic symptoms as soon as possible. And that's what we call STAT. Okay, so we're going to learn more about his fat theory in a little bit here. So let's go right there. Okay, so although Dr. Taylor is correct on the mechanism of action, the solution should be sustainable lifestyle choices instead of quick fix smoothies and desperate diet cycles, according to Dr. Peter Rogers. And according to Anthony William as well, your liver only gives you about 3 chances before it stops you from losing any weight, no matter what diet you're following. Okay, so then there's Dr. Gerald Schulman, who won the Banting Lecture in 2018 on the personal fat threshold. So he basically states that individuals have a limit of how much fat they can store without resulting blood sugar imbalances. All right, so we're going to get back to all of these links, okay? So the first link is going to be to Michael Brownlee's lecture, and then we'll cover the short by Dr. Rogers, which is like a 8-minute, 9-minute video that covers Dr. Brownlee's research. And then Roy Taylor's link is 20 minutes of a Banting lecture that he gives. So we're just going to do a 5-minute short by Dr. Rogers that's going to explain that to us. And then there's Dr. Schulman's lecture. We're going to see that link is about an hour long. So we're just going to do the short by Dr. Rogers, which is about 4.5 minutes long, so that you get the gist of what these lectures are about, and you can begin to understand that it really is fat in the muscle cells, excess fat in the muscle cells and in the liver, which cause the beginnings of what we call diabetes, okay? All right, so Dr. Rogers then postulates that toxicology plays a role in the ectopic fat threshold. That means that your body, if it's dealing with things like nicotine or volatile organic compounds or ultrafine particles or cancer-causing chemicals or heavy metals such as nickel, tin, and lead, and I'm going to put aluminum and mercury on this list as well, or flavoring such as diacetyl, a chemical linked to serious lung disease we call popcorn lung, or other chemicals, fragrances, or things in the environment, or forever chemicals like DDT and things like that, and radiation, which is, of course, coming out of the sky from Hiroshima and Nagasaki still. We have things in our environment that have never been here before. And fat cells have the amazing capacity to glom onto those toxins and chemicals and hold on to them so that they encase them and keep them away from your heart or your brain so that you don't have a stroke right away, you don't have a heart attack right away. So it keeps you alive, and your liver is going to hold on to those things, even causing some scar tissue if it does not get a vacation from that. All right, so let's go back to these and the lecture, things like that, and I am going to go ahead and take myself off of that screen so you don't see me anymore. Okay, so here the first link will be Michael Brownlee's lecture right here. So you can see it at diabetesjournals.org. It is right there, and then you're going to be able to read it. And if you sign up with the diabetesjournals.org, if you sign in, okay, they will let you watch his lecture for free. But it's not available on PubMed. Not even the abstract is available on PubMed. It's kind of hidden from us in that part of it. But it's the most amazing thing you'll ever read or watch. And let's just give you the short on this. It's about 9 minutes by Dr. Peter Rogers. And I'm going to...
Is Michael Brownlee's paper on diabetes, the unifying theory of complications of diabetes. This is a major AO, academic orgasm. This is one of the most beautiful papers I've ever read in my life. It's a work of genius. This guy's an absolute genius. He deserves a Nobel Prize. He'll never get it because they don't want the public to know about this paper. And the bottom line, what was the main finding? The main finding was that excessive dietary fat will cause reversal of electron transport in mitochondria, like at complex 3, and then you'll get the electrons being dropped off the electron transport chain. They'll drop onto oxygen and they'll produce a superoxide. The point of all this is that the main cause of insulin resistance and diabetes is due to excessive dietary fat. So the smart thing to do for a diabetic, type 2 diabetic, is to eat a low-fat plant-based diet. Okay, it's obvious once you understand this. And the paper is so brilliant because he confirmed this in so many different ways. He just made it, real solid. Okay, I'll show you in a moment what happens at PubMed. They don't even show you the paper or the abstract. But if you go to diabetesjournals.org, you can get the paper. I'll show you on the next slide the paper itself. Okay, and it's just fat in general, but fat in particular. And I think it's because the lack of double bonds creates an additional FADH in the process of beta oxidation, leading to more electrons quickly being sent to the electron transport chain and overwhelming it. Excuse me. It's sometimes referred to as overnutrition. Once you back up electron transport in the mitochondria, you will then cause a backup, like a traffic jam, in the tricarboxylic acid cycle, also known as Krebs cycle, and you cause a backup of glycolysis. I'm going to get into a little technical detail here. You don't need to know the details, but just when you read the paper, if I tell you this, you'll understand the paper faster. The superoxide anions can lead to complications from free radicals. ROS is reactive oxygen species. If, again, the mitochondria is overwhelmed, they're not able to neutralize these free radicals rapidly enough, okay? And then you can get DNA damage in the mitochondria. You can get DNA damage in the nucleus. And you'll activate something called PARP. It's like the polyadenosine protein for DNA repair. And that actually goes to the glycolysis cycle in the cytoplasm and will inhibit 3-phosphoglyceraldehyde dehydrogenase, and that will then divert it 3-PGA into MGO, methylglyoxal. So I know I'm getting to a whole bunch of technical stuff, but the reason I'm doing this is because this is how diabetes becomes a metabolic disaster. The methylglyoxal side reaction from glycolysis produces advanced glycation end products, and they can exit the cell and go around glycating things all over the place, and you get all these metabolic disasters in diabetes. Diabetes is a disaster. The average ignorant patient always says, it's in control, it's under control, I'm taking my pills. They don't understand. It's not under control. The smart move is lower your fat intake, okay? And this is not known. You'll go to fellowship-trained endocrinologists at the biggest name universities, and they won't know this because I talked to a bunch of them. And the ones I talked to, none of them had even read this paper. None of them knew about this paper. None of them knew about the other major papers in diabetes. None of them knew about the low-fat diet. It's amazing how little they know. Amazing, literally. All they know is the drugs. And when you read, all the medical student books, residency books, they're always going to be a big picture of, Banting and Best, the discoverers of insulin, because it's a drug. But the guy who actually figured out what happens in the disease, no one's ever heard of him. Okay. What else? Then the thing that happens is because you have insulin resistance in the skeletal muscle cells, normally after you eat, that's called postprandial, after eating, most of your glucose, the majority of it, should be taken up into the skeletal muscle cells and stored as glycogen. However, when the skeletal muscle cells are insulin resistant, they don't take up that glucose. So then a lot of it, gets stuck in the blood. You have postprandial, after eating, hyperglycemia, high blood glucose. And some of that excess blood glucose will go to the liver, and the liver progressively becomes fatty. And I talked about that with my previous references, 2 recent lectures. I'm kind of giving you all the diabetes lectures here, all 3 in a row together. You'll get a fatty liver from that excess glucose. But here's another bigger problem. The high blood glucose will then go to cells which cannot control the rate of uptake. The skeletal muscle is sort of like perfectly designed to just take up extra glucose after you eat, to store it as glycogen. The muscle is like the biggest organ in the body, skeletal muscle. Okay, but the point is there's other cells in the body, like your endothelial cells, I abbreviated here, ECs. They take up glucose at a rate proportional to whatever the blood glucose level is. That's why if you have prolonged hyperelevation of your blood glucose, hyperglycemia, those cells take up too much glucose. And this same process, you can call it overnutrition, overwhelming the mitochondria electron transport chain. This is located on the inner mitochondrial membrane. If you too rapidly send electrons to it, it gets overwhelmed and it starts to back up and go backwards, and then you produce these side reaction products, reactive oxygen species like superoxide anions, and those can get made into hydrogen peroxide, and if you can't detoxify that, like with catalase, then that'll get made potentially into hydroxyl radicals, which are quite hyperreactive and can damage the mitochondrial membrane. So that the cells that can't control their uptake of glucose in the setting of hyperglycemia include the endothelial cells, so you get what's called the microvasculopathy, a disaster. That's why diabetics get their foot amputated all the time. It's in the small vessels of the foot. There's nothing to bypass too distally. It's too small to angioplasty. It happens in the eye, diabetic retinopathy. It happens in the kidneys, diabetic nephropathy. It happens in the peripheral nerves, diabetic neuropathy. You get there's a slightly more complicated mechanism of injury to brain cells, but you get insulin resistance in brain cells as well, and that causes cognitive decline. I've given a whole bunch of much more detailed lectures about this. If you want, just go to the playlist for diabetes. You'll find all these lectures. But it's a real disaster. So you get insulin resistance in brain cells because everyone says they only have GLUT3 transporters which take up all the glucose. That's not true. They also have in the hippocampus and some other locations glucose type 4 transporters, like in the skeletal muscle, are insulin dependent. So that's a big disaster. Plus there's something called, I go through all this in my other lectures, but mitochondria associated membranes, MAMs, that couple the glucose intake to calcium being sent into the mitochondria to quickly upregulate the mitochondrial Krebs cycle enzymes in the setting of, an acute event when the person needs to function more rapidly and intensely. So that's why diabetics can't handle intellectual stress very well. I give entire other lectures about that, so I don't want to get into all that. I'm just sort of, giving you the trailer to the movie, okay? All right, so here's something I want to show you, because this will help you understand how stuff really works in the real world. If you go to PubMed, PubMed right here, and that's where people look for most research papers. They will not show you this paper. They'll show you the title of the paper. They'll show you Michael Brownlee's name. Look at this. No abstract. They not only don't show you the paper, they won't even show you the abstract. Okay? That's BS. All right? So think about that. Like, just about the most important disease, and it's been figured out, and no one's allowed to know about it. Okay? Because they don't want you to know about it. If you eat low-fat diet, they're not going to make money off you. Okay, so PubMed is no abstract. However, surprisingly, the entire paper is available free if you just go to this website, diabetesjournals.org. And here's the paper, The Pathobiology of Diabetic Complications, a Unifying Mechanism by Michael Brownlee. And he won the Banting Lecture Award in 2004 as the best diabetes researcher in the entire world. And I'm telling you, this guy is a super genius. I almost wanted to cry when I read this paper. It was so intellectually beautiful. It was just awesome. And then he gave the diabetes lecture in 2005 with the American Diabetic Association. You have to log into their site, the American Diabetes Association. I think it's diabetes.org. You have to log into their site, and they will let you watch his lecture of this. So if you want, you can watch his lecture. I can also tell you, I've made multiple lectures on diabetes, and I explain it in much more detail. So if you want to watch my lectures about it, I'll go in this much more detail in all my lectures. You go to my playlist on diabetes if you want to understand this. So anyways, I thought this was beautiful. I thought it was useful. So there it is.
All right, here's the link to Roy Taylor's presentation in 2012, What Predicts Drug-Free Type 2 Diabetes Remission. And so I will link that below, and it is also, since it's 20 minutes, I'm going to go over to the Roy Taylor lecture by Dr. Rogers again. Okay, so we've got that. Here, so you can see that, and I'm going to full screen it, and I will get out of the way once again.
Okay, this lecture is about the Roy Taylor's diabetes lecture. I'll have the link to his lecture below. He also won the Banting Award, him in about 2012, for the greatest diabetes researcher in the world. He's from England, a physician over there. He did some research at Yale with Gerald Schulman, who I just had a video about the previous video and a link to his previous lecture, Banting lecture as well. What Roy Taylor showed was that you could determine how much fat was in the patient's liver using MRI. And when you had the patient lose weight, they would lose the fat initially from the liver, and once they decreased the fat in their liver, they no longer had liver insulin resistance. And that's a big deal because insulin resistance in the liver itself leads the liver to not be able to shut off gluconeogenesis. Because normally while you're fasting, the liver is what maintains your blood glucose level. It's constantly pushing glucose into the blood because it has to make sure that the brain gets enough glucose. If your brain doesn't get glucose, your brain dies. It can only go about 4 minutes without adequate glucose or oxygen. So that's the big job of the liver, is to make sure the brain has enough glucose. And the point is, when you get a fatty liver, and I can tell you, most American patients, the majority of them in my experience, over 50 years of age, have a fatty liver. What that means is the liver is developing worsening insulin resistance such that part of its problem is that it can no longer accurately sense the blood glucose level, and it'll keep on pushing too much glucose into the blood, causing high blood glucose levels, hyperglycemia, and that will start to damage other tissues, especially the endothelium, including the endothelium of the capillaries in your brain, and that leads to problems with the blood-brain barrier, lack of oxygen and glucose delivery to the brain. It's a big disaster, okay? And so what was a miracle about this guy's research is he showed as perfectly as you could show it. You just lose the weight, you will lose the fat initially from the liver. When the liver fat is reduced, the liver will start to function correctly again and maintain a correct blood glucose level during the fasting phase, and the person will be healthier, dramatically healthier. Okay, let me show you the picture. It'll be more dramatic once I show you the picture than just having me talk about it. As a matter of fact, he even defines type 2 diabetes as fat accumulation in the liver. That's how confident he is about his understanding of diabetes. Okay, so here is, let me shrink this picture here. So here's a picture from Roy Taylor's research. You got color-coded liver MRI images here. So here is the baseline fatty liver, and this patient has 36% of the liver contents are fat. And again, I look at fatty livers every day. I see them on CAT scans, I see them on ultrasounds, I see them on MRIs. It is so common, it's unbelievable. Basically, I know if a patient has a kidney stone, they probably got fatty liver because it's the same diet that causes kidney stones and causes fatty livers. If they got a lot of coronary artery disease, a lot of cerebrovascular disease, they've probably got a fatty liver. If they got diverticulitis and all that abdominal pressure syndrome stuff that comes from eating a high meat diet, they probably got fatty liver. Okay, anyways, he got his patients to lose weight, and just within 8 weeks, once they lost their weight, and it wasn't that much weight, the fat tended to be lost first from the liver. Notice how it's no longer yellow, now it's blue. So he was using yellow to code for fat. And so red was the highest amount of fat, sort of this greenish yellow was the next amount, and then blue was very low fat. So the liver in 8 weeks, just from losing, I forget the amount, it was somewhere in the ballpark of like 20 pounds, which isn't that much weight in a lot of these big fat people. The liver would lose the fat first. It would drop down to 2% liver fat, so now it's blue like this, so hardly any fat in the liver at this point, and the patient would show dramatic improvement. I'll show you on the next slide what happened to their blood glucose level. It's rather extraordinary. This is an AO, by the way, academic orgasm. Okay, so here is the patient's blood glucose level, and once they lost the weight, it just normalized, okay? So basically, for the patients who had diabetes, type 2 diabetes of less than 4 years duration, just a relatively small amount of weight loss cleared the fat out of their liver. Their fatty liver, once that was resolved, their blood glucose, their fasting blood glucose, incredibly improved, essentially normalized. Okay, so I'll give you a link to his lecture and below. It's a fantastic lecture, and it's worth watching. It's real short. I think it's about 6 minutes, something like that. And so these are the great lectures, researchers, papers in the history of diabetes. And it's dramatic because I told you I went and met with the endocrinology doctors supposedly described as the best ones in the giant city. And these university doctors hadn't read any of these papers. They don't know any of this stuff. And this is really basic. You can learn this in a 5-minute lecture, and they don't know it. Okay? So anyways, I will put the link below. You can see Roy Taylor's lecture on diabetes. This is fantastic work. This is genius level work that can save a lot of people's lives.
Okay, here's the Banting lecture of Dr. Gerald Schulman. It's about an hour long, so I'm going to go ahead and close this out and open up the review from Dr. Rogers that's about 4.5 minutes so that you all understand. And then I'm going to link the Banting lecture here by Dr. Schulman below so you have that as well if you want to go further into that.
Okay, this lecture is a diabetes lecture by Gerald Schulman about the ectopic fat theory. This is Gerald Schulman here. This guy's a real genius. He's MD, PhD, he did his fellowship in endocrinology at Massachusetts General Hospital, and then the big thing he became most famous for was his work at Yale University, where he was working with nuclear magnetic resonance spectroscopy, and he confirmed that the earliest detectable finding of diabetes is the accumulation of fat within the skeletal muscle. Okay, that's actually a big deal. I mean, there were other research. You can go back to Sweeney, 1927, feeding high-fat diets to medical students, showed that it's high dietary fat that causes insulin resistance. And you can also look at the work of Michael Brownlee. Michael Brownlee did genius-level work. He wrote that magnificent paper called The Unifying Theory of Diabetic Complications. You can get that from the American Diabetic Association website, and if you log into their site, you can watch his lecture, the Michael Brownlee lecture, okay? These guys are both geniuses. These are guys at the top of the top of the top. Brownlee won the Banting Award in 2004. Gerald Schulman won it in 2018. That's for the best diabetes researcher in the whole world, and it attracts the top brains. Okay, so anyways, his lecture, Gerald Schulman's 2018 Banting Award lecture, is viewable on the internet. There's a couple spots. I'm going to put the link to it below. So the reason I'm showing this to you is the fundamental problem with almost all the people in Western countries, the United States especially, is they got diabetes or insulin resistance, and they've got hypertension. And then diabetes and hypertension feed into coronary artery disease, cerebral vascular disease, impotence, and a whole bunch of other problems, ischemic spine, etc. So in his lecture, it's a great lecture. It really is great. That's why I'm showing this. I'm trying to bring you the best stuff. And you know, there's like an ocean of BS on the internet. And what I'm showing you here is this is the best stuff. This is one of the all-time greatest lectures ever in the history of diabetes. Okay, so, and he'll also call his theory of diabetes the ectopic fat theory. Okay, diabetes is actually real complicated, but that's the money finding. And I'm going to show you another lecture after this in a separate video by Roy Taylor. And these are like the 3 best papers. If you only know 3 papers to read about diabetes, it would be the Brownlee paper on Unifying Theory of Diabetic Complications. And I would recommend you watch the Schulman lecture. His lecture is fantastic. It's a lot easier to follow than his papers, which are often quite long in detail. And then I'm going to show you one image from his talk. I have one more image for this particular talk here. And then the Roy Taylor talk. Those 3 talks, and you are good to go on diabetes. Don't get me wrong, there's other great lectures on diabetes, but I'm trying to give you the best of the best stuff here. Okay, here's a typical slide from his lecture, from his Banting lecture 2018, Gerald Schulman here. And you know, this is great. This is basically the physiology of when a person eats a meal. So you eat the bread, for example, and then that's going to cause increased blood glucose. When your blood glucose is elevated, your pancreas senses it. Your pancreas releases insulin. The insulin then goes to the muscle. It binds to the receptor on the skeletal muscle cell, causes that cell to send its glucose type 4 transporters up to the plasma membrane. They will then allow glucose to come into the cell. It gets phosphorylated right away to sort of trap it and then run it through glycolysis or store it as glycogen. And that phosphorylation puts a charge on it so it can't exit back out through the transporter, and it removes the concentration gradient, so to speak, of just pure glucose. So anyways, that's what happens. And also the pancreas, which had been producing glucose through gluconeogenesis, for example, while you were fasting to maintain your blood glucose level, to make sure your brain gets enough blood, once it senses that there's glucose in the blood, it will stop releasing glucose into the blood. That's all normal. And then he's going to go in this lecture into what happens in an abnormal situation. When you start accumulating fat in the skeletal muscle, you'll then get resistance, insulin resistance. They call it nutrition overload, if you will. And then the the insulin binding the insulin receptor will not be able to send the GLUT4s to the plasma membrane, so glucose will accumulate in the blood. When it accumulates in the blood, it goes all over the place, including it goes to the liver and starts being stored as fat. In the liver, you get a fatty liver. That's an important point. You get a fatty liver from hyperglycemia. Okay, and then once the liver's fat, it can no longer sense blood glucose levels accurately, and it'll keep on sending blood glucose into the blood, breaking down glycogen, for example, or running gluconeogenesis, making glucose out of amino acids, for example. So you'll have chronic, prolonged, sustained hyperglycemia, including in the fasting phase. So anyways, the link is below to his lecture. It's a fantastic lecture, one of the best lectures ever given in the history of the world on diabetes. So if you're interested in diabetes, I recommend you check it out.
All right, thanks so much for watching those 3 short videos on those researchers that talk about diabetes and what the cause is of diabetes. I have a consensus document of 66 plus doctors who all follow the same lifestyle changes for their clients, for their patients, and they have been able to overcome this crippling condition, as well as everything that goes along with it. If you've noticed in those little lectures, the cascade of metabolic issues that are related to a fatty liver are lots of things that Bowenwork has procedures for, but they really are chronic and therefore require that 80-20 or the lifestyle change that goes along with what we're talking about. The cascade of diabetes is the same cascade of heart disease. It's the same cascade of dementia. It's the same cascade of everything, basically. Everything that goes wrong in your body starts with the liver. And so if you can become friends with your liver, the better, the faster that you can do that, the better your life is going to be. And that's why I made this lecture about diabetes, because it's not just diabetes, it's like everything. And so it's like the unified theory of all illness. And what Bowenwork does in talking to the nervous system, if it doesn't have the right energy resources to begin that to begin that rebalancing, it's not going to be able to rebalance fast enough for you to see results that you want to see. So I'm trying to encourage you to be able to think ahead a little bit and be able to see what your goals are and what you can do to follow that 80-20 a little bit better and get your energy resources in line. All right, thank you. Have a great day. Okay, bye-bye.